Therefore, if the patient is diagnosed by one treating physician, does not mean that that one treating physician knows everything about the treatment regimens and the treatment options. So therefore, every single newly diagnosed cancer patient should be discussed in the multidisciplinary team meeting. Today it was the same 20 years ago, but the options that we had 20 years ago are different today. So we have multiple options how we can treat a patient. And if we're just focusing on the most advanced treatment options that we have in GI cancer, for example, it's just important to have an experienced radiologist, an experienced interventional radiologist, an experienced surgeon on different topics of surgery, and well established in regards to treatment options, medical oncologist, a pathologist. So there are several people that have to be present to discuss patients. And even more important is that the treating physician is present as well, because there has to be one who knows the patient. So this was a study done by the well-known AMC Center, which is a center in Amsterdam. And what they looked at prospectively in patients that they've seen in their MTT meetings over half a year, more than 500 patients were discussed in these meetings. What they looked at was, first of all, how accurate was the diagnosis with which the patient came to the MTT meeting. How often did they have to change the diagnosis and therefore the treatment for the patients? And what was the outcome in regards how did the patient really receive the treatment that they agreed upon? They were quite well in regarding to the correct diagnosis. There was only a change in 20% of the patients within the discussion in the MTT meeting. So therefore it's important to discuss these patients within specialists and not one single person. What was important was that there was the treating physician present as well, knowing the patient and the circumstances. And so it was not important how many patients were discussed and how often the patients were discussed. What was, however, also interesting was that the decisions were implemented in most of the cases, so 94% were implemented. And what they also found out and concluded was that it's important to have the patient's wishes included in the discussion and the decision made, and certainly the performance status well known from the patient. So how fit is the patient? So what can he tolerate treatment-wise? In most countries, it's meanwhile, so in Austria, for example, it's law. You have to discuss every single newly diagnosed cancer patient within an MTT discussion. The problem is, even having it as law, that the doctors have to understand there is nobody's controlling if every patient is discussed. So I personally don't think that we need the police to control if the patient is discussed in an MTT meeting, but the cancer treating physician has to understand that it's better to discuss these patients in MTT meeting than to decide on its own which treatment is the best. The main thing that ESMO will have to do, and does already, is that they have to support MTT as an essential requirement before, and that's important. You should not discuss that patient after the patient has already received the treatment. You should discuss that patient at the very beginning. So ESMO should promote the initial discussion of every patient in such an MTT meeting.